My name is Jonathan Lopez. I'm a former student of OMI, and currently I'm working at American Medical Response in Auburndale, Florida. Basically, I chose this line of work because every day I was going through life and I didn't feel like I was actually making a difference. So I decided to switch my careers to EMS basically because I wanted to know that every day I did something to help somebody else in the world. I didn't want to go through my week thinking I didn't do anything this week. I wanted to know that I accomplished something and I made a difference in the world around me basically. My main inspiration was my grandfather. He was a volunteer firefighter. So right now he's battling Alzheimer's. So I wanted to do something that kind of uplifted his spirits. Every single time when we meet, he loves to talk about it whenever he remembers it. So it's great to see the smile on his face when he knows that I'm following in his footsteps. I actually gave him my first patch that I got from the NREMT. So he loves that. It's kind of my way of giving him a reminder. So whenever I do see him, hopefully he's seen the patch and he remembers and everything. And it just brightens up his day. I chose OMI because it was an accredited school. It was close by. For the Florida area, you have a lot of EMS schools that are around, but they don't have the history or the backing that OMI has. They have a lot of different accreditations, their instructors, their teaching and everything. It's not you sitting in the classroom and looking at a screen all day. You have a screen there that follows the bullet points that they're talking about, but your discussion is between you and the instructor. So it's not kind of a separation of you and the school itself. It's more of an involved environment. So it gives you more of an offering of being able to question and have an actual discussion about your topics.
Is it hands-on or just books?
It's a combination of both. When you first start in the school, you're going to be more into the books because to be hands-on, you have to have the knowledge base to actually do what they want you to do. So before you get into your airways, messing with the oxygen tanks and everything, you're going to go through the chapters first so that you understand what you're going to be doing throughout that lab. So in the beginning, it's going to be about the books, but the further you get into it, the more hands-on experience you're going to be getting through the school, as well as with your clinicals as well. So I think it was a quarter of the way through my school, I started doing my clinicals because the labs and everything got me prepared to where I knew that if I was going to do my clinical and I was going to be on the road with a paramedic and an EMT, that I wouldn't be stumbling over myself. I'd actually know, okay, I learned this in school already. Let me go ahead and apply this. Let's see, one of my best memories of the school is the last couple months you're only doing assessments. And we had trauma assessments, medical assessments, and just random little scenarios that they give us. And they they gave us a, what was it, a puppy monkey baby scenario where it was like we're in like a zoo and puppy monkey babies were like attacking people and we had a patient that we had to deal with. So they played like sounds and everything of screaming and whatnot, and the instructor was there to like add pressure, but the little fun quirks to it got us more excited for the actual assessments themselves. So we did a lot of serious ones, but when we got our hands in and everything and we're comfortable with it, we started having a little bit more fun with the assessments, had little quirky scenarios. I'll say that it is. Don't go in expecting that you're going to be working for county right away. You're going to be making top dollar and everything. You're not going to make what a 20-year-old experienced EMT is going to be making right off the bat. You got to start somewhere. I'm working with American Medical Response. They hire a lot of the new people so that they can start getting their experience and everything in the field, hands-on. I know some people that did get the county positions, so within a month of starting. I got my position within a month as well. So it's kind of like you just put your name out there, start applying for places. For everybody that passed EMT that I kept in touch with, they all found a position within 4 weeks to 2 months. So So it was a pretty good experience as far as going to all the different interviews. You kind of figure out what they expect of you, and you kind of go from there judging your experience as well. Where I see myself in the future is I want to stay with the company that I'm with right now because it has so much opportunity. They have everything from aviation. You can be out in the sea working on oil rigs and everything. So it's a pretty big company. It has a broad base. I can work anywhere in the U.S. that I choose to with the same company. One thing that I want to do for them, though, is I want to get into my paramedics. I want to get my firefighter certification and my CCEMT so that I can do my critical care transports. Saying that, I hope that I'll be able to move on to supervisor positions as well, and hopefully have people under me that I can guide and push them through their starts of their careers as well. If you're going into the EMS field, try not to think about, oh my God, I got to do these tests. I have to pass all my tests with this percentile. Don't second guess yourself. When you're going into this field, go into this field saying that you want to help people and that you want to make a difference. Know why you're coming into the EMS career, and I promise you, you will go through it with flying colors. Because it's one thing to go into a school thinking, oh my God, I'm going to fail. But it's another thing going into the school saying, I'm going to do this for this purpose, and I'm going to make the best experience out of this possible. I went into this place knowing that I wanted to make a difference and that I wanted to have a different career choice. As far as I went from real estate to where I had no idea what I was doing with my life, to EMS to where every single day I have a chance to make somebody smile, make somebody healthier, and help them pretty much get through a tough time in their life. So if you go through with that mentality that you're trying to help people, it's going to be a lot easier mentally to focus on school than it would be if you go into with a negative aspect. Me, I'm not a good test taker myself, but going into this, I just crammed to where I was so motivated in the fact that I was going to pass it, that by the test came up, the first test I was nervous, of course, but every test after that, I was like, I got this, I'm good. So you have to focus on your goal and where you want to be in life, and you'll do amazingly at it. Everybody's going to have their own reasonings for it. A lot of people will give you the standard phrase of saying, I want to help people. Me, for myself, mine was that I wanted to know that my life actually had purpose, that what I did actually had meaning, and that I was actually making a difference in the world around me. So everybody's going to have their own mentality as far as why they want to do it. One thing I will tell you is not to do it for the money. EMS is not about the money. It never was, never will be. You don't go into this field saying, I'm going to be rich, I'm going to have a mansion out in Windermere, and it's going to be awesome. You go into this because it's something that you mentally are prepared for and are willing to make sacrifices of your own personal time to make the world a better place around you. It's definitely worth it. Every single day when I go into work, I got a smile on my face because I know that is another chance for me to do better. So with this career here, it's like, it's more fulfilling in your life. So you're not going to go into the workplace and say, oh man, I got to do my 9 to 5. I'm going to do this and head out. No, you're going out there, you're saying, okay, I got to get all my supplies ready. I got to get my truck ready, get everything cleaned up and head out. We got patients to take care of. So you have more of a fulfillment within your life, and it's definitely worth it.
So you're happy with the decision that you made?
Extremely happy with the decision that I made. Wouldn't take this back for anything in the world. So if I'm stuck as an EMT for the rest of my life, I'll be the happiest man.